in the August edition of the EHA Clinics webinar. I trust will be having a good time. So just give maybe the next 3 minutes to allow some of the participants join. Today we'll be talking about achieving patient satisfaction through quality healthcare management, and our presenter is Dr. Aliu Israel. I'm sure we'll be having a very great time in the presentation this evening. Now, EHA Clinics Academy has been on for a little while now, and we've been giving quality educational content for medical professionals, medical laboratory scientists, technicians, doctors, nurses. We try to bring content that are relevant for our practice. EHA Clinics is poised and is targeted at quality. At EHA Clinics, quality is premium. We're willing to pay whatever it would cost to give our patients the top quality and produce quality results for the care of our patients. And because in the medical field, continual professional development is key, we are doing this as our own contribution to the knowledge pool and eventually to quality practice among Nigerian healthcare caregivers. So I'm sure we'll be having a good time this evening. Also know that certificates will be awarded for free. So please, I want you to make sure that the name you're registered with, in the way you presented your names, you wrote them in the way you want to have it in your certificate. Please, if you're not sure of that, perhaps you may need to log out and try logging again to correct that. I've seen some people, when we want to process the certificate, maybe the app gives a name. You see Zoom user, you see Techno 102 as the name of the person. And that's difficult to generate a certificate for such a person. So please make sure that your name is presented in the way you would want it to appear on your certificate. So please, if you have friends, professionals, colleagues who haven't joined, maybe you could kindly remind them, drop the link on their platforms. Aliu Israel, good evening, sir. Dr. Aliu, can you hear me, sir?
Yes, I can hear you. Good evening.
Yeah, good evening, Dr. Aliu Israel. Thanks for being with us this evening. Dr. Aliu Israel is a household name within the medical laboratory science field. I'm sure you would agree with that. His name rings the bell once you mention quality or quality management systems. He's a healthcare consultant and is also the national laboratory manager for Lancet Laboratories. I have been following him on his wall for a while, and I know he's passionate about what he does. All right, he's a young man like a lot of us, and I'm sure he'll be bringing cutting edge dimension to patient care that will be relevant to us in our practice, in our various spheres. All right, so without saying so much, I believe that Aliu Israel can now have the floor. All right, Dr. Aliu Israel, you now have the floor. Please carry on.
Okay, please just give me like 2 minutes. Let me share my slide.
Okay. So while he's doing that, please, if you have questions, I think we didn't enable that anybody can unmute himself, just to make the whole presentation to be unrowdy. So you can you can use the chat box or the Q&A section to drop in your questions while the presentation is going on. And I'm sure our presenter will be magnanimous to give attention to those questions in about an hour that he'll be speaking to us. All right. So good evening, everybody. Thank you for joining. Please keep joining. If you can publicize it, quickly do that. Let's have more numbers rolling in here.
Okay, good evening, everyone. And
yes. Okay, we can't see your screen yet. I don't know if you've shared.
Okay.
Okay, it's coming up.
Okay, can you see my screen now?
Yeah, perfect.
Okay. All right. Sorry.
Hello, Ali Israel. Are you still there?
Yes, I am. Let me just.
Okay.
Yeah.
Okay.
Okay. So, can you see my screen? Good evening.
Yes, we can, sir.
Okay, can you hear me loud and clear?
Loud and clear. Very clear.
So, good evening, everyone, and thank you for the opportunity. Thank you for having me tonight. I've been following this program actually the last two sessions, and it has really been an amazing one and something that is worth it. So when I had opportunity to be a part of it from this side, I I didn't hesitate to jump into that opportunities and so thank you for having me, and thank you to the organizers, EH Clinic, and of everyone who has made this program a success all this while. So I'll be going straight to the presentation for today. Uh, the topic before me is achieving patient satisfaction through quality healthcare management. And by way of recognition, my name is Dr. Ali Igwe. I'm a quality management system and a healthcare management consultant, and I'm also the national lab manager of Lancet Laboratory, among others. So been going straight to the program, and the goal of this webinar is to explore and understand how patient satisfaction can be achieved through the instrumentality of quality healthcare management. So the goal of this program is to explore and understand how patient satisfaction can be achieved through instrumentality of quality healthcare management. So by way of introduction, patient satisfaction is the core essence of the healthcare delivery, and the quality of healthcare is a function of many building blocks, which centered around the quality of healthcare management. Now, the patient is the core essence of the healthcare delivery. In other words, every healthcare provider must be able to identify the needs of the patient, be able to meet the needs of the patient, and exceed the need of the patient, and also meet the future need of the patient. So it is worthy for us to know that patient satisfaction is not just one ideology, but patient satisfaction is not just one feeling that a patient feel. No, but it is the core essence of the healthcare delivery, the core essence why the healthcare system is being put in place. Because without the patient, definitely there are no healthcare system. And to be able to meet the patient satisfaction, there are a lot of functions, a lot of building blocks. And one of the building blocks is what we are going to be talking today: quality healthcare management, which is part of the building blocks to help for patient satisfaction. I did a research on patient satisfaction in the tertiary institution in Nigeria, and it will interest you to know that a lot of factors that contribute to patient satisfaction and patient management. And one of those key or pivotal functions or roles that affect the patient satisfaction is the quality of healthcare management. Now, just as we all know, there's a saying that says everything rises and falls on leadership. So in other words, it is the management of an organization, of an institution, that determines the patient satisfaction of that particular organization or that particular institution or that particular healthcare service. Now, in continuation, what is patient satisfaction? Patient satisfaction can be defined as a quality indicator commonly used or described as a quality indicator that is commonly used in measuring the quality in healthcare. Now, patient satisfaction affects both the clinical outcomes, the patient retention, the medical malpractice claims. It affects the timeliness, the efficiency, and the patient-centered delivery of your quality healthcare. And this is very important. Now, when we talk about quality indicators are tools that are used to measure a particular service or a particular stuff, a particular program or a particular effectiveness of particular. So we can describe patient satisfaction as a quality indicator that it's commonly used to measure the quality in healthcare, the patient satisfaction, how it affects the clinical outcomes, retentions, and the rest. Now, when we talk about the patient experience is a journey of the total care and output of patient that the patient receives from the healthcare delivery organization. Now, let's say, for example, a client or a patient. Okay, when I use the word client or customer or patient, I make reference to almost the same thing here. But however, patients are more specific. Now, when the patient walks into your facility, whether it be the laboratory, whether it be an healthcare organization, whether it be a hospital, whether it be a station. Now, from the time the patient comes in to the time patient is being attended to, the waiting time, the ambience, the reception, what else again, the services, the consultants, the expertise, the results, the technology, everything that the patient passes through, he either enjoys it or suffers it at every particular period of time. Now, that is what is called the patient experience. So what is your patient experience in your particular organization? When a patient walks in, until the time he gets a result or gets his treatment or whatever it is that the patient comes into, what kind of experience can your facility or can your organization tell? Can your patient tell about it? So the totality of the service determines what? The patient experience. Am I communicating?
Oh, we can hear you. Yes. Yes, you are, Mr. Israel. Are you still there? Hello?
No.
Yeah, Dr. Israel, we can hear you. Hello, can anyone hear me? Mr. Sunday Luca, can you hear me? I'll mute your mic.
Yes, we can hear you. I think he's having some network issues.
I think we lost you, but you got back.
Hello, can you hear me?
Yes, we can hear you.
Okay. Were you hearing me? I think before the interruption.
Yeah, okay, we're hearing
so
you.
Please, hello. Yes, I want you to, since everybody is muted, please, I want you to, you respond to me so that I can know that I'm still talking because due to the network.
Sure.
Okay. Thank you.
Okay, now we're not hearing you.
No, just can you see my slide?
No, I guess it's still coming up as your picture we're seeing at the moment.
Okay. Share screen.
Okay, it's coming up. Yeah, we have your screen now.
Okay, so I talked about oh yes. Sorry, can you hear me? Can you see my slide?
Yes, it just came up.
Okay. So we talked about the patient experience, that is the journey of the total care and output the patient receive from the healthcare delivery organization. In other words, when a patient comes into your facility, whether it be for lab test, whether it be for hospital, whether it be for checkup, whether it be for whatever it is. Now, the total experience from the personnel that attends to him or her, the quality of services, the ambience, the results, the technology, everything that is deployed determines the patient experience, even the environment, even when the result, everything is quality, when the service is quality, the patient care is quality. Now, everything about it is what we refer to as patient experience. Am I communicating?
Yes, you are, sir.
Yes. So now, take care of the patient and everything else we follow. Now, it is necessary and important for us to understand that we must take care of the patient, irrespective of wherever you are found, irrespective of your team, irrespective of your support, irrespective of wherever you are. We have to take care of the patient. Now, there's a saying that says in patient experience, this has to do with the sum of all the interaction that is shaped by the organization, the culture, the influence, the patient perception across the continuum of care. So that is patient experience. Now, the next is the healthcare management. When we talk about the healthcare management, this is the overall management and leadership of both public and private healthcare organizations. Now, the healthcare management is a place to ensure that all of your operations, either in an entire healthcare sector or in a particular sector, are maintained seamlessly. That is healthcare management. So the overall management and leadership of both, it could be a public sector, it could be a private sector, ensure that all the operations of either the entire healthcare sector or a particular services are maintained seamlessly. Now, in healthcare management, now one of the foundation of the healthcare management has to do what, or the core function of the healthcare managers include planning, just as the way we have normal management, planning. So they are involved in planning, in directing and coordinating of clinical and non-clinical activities within the respective healthcare establishment. So they're also involved in managing of budgets, finances, and the overall healthcare establishment. So when we talk about healthcare management, they also saddle the responsibility of creating work schedules for the staff, as well as planning for when new staff should be hired and when staff should let go. Now, when we talk about healthcare management, they're also involved in the overseeing of the individual department to ensure that they are running smoothly and effectively. Now, healthcare management also involves carrying out quality assurance, risk assessment work, maintaining patient satisfaction and patient well-being. Now, healthcare management also involves the supervision of staff, including whether they are MLS, whether they are doctors, whether they are nurses, whether they are pharmacists, or any other healthcare providers. So these all are like the core functions or the general functions of a healthcare management. Now, the whole essence of it is to provide leadership for the organization. The whole essence of it is to provide what? Leadership. Remember, the essence of the organization is for what? The healthcare, the service is for what? It's for the patient. Now, if the essence of the healthcare services is for the patient, then the essence of the healthcare management is actually for the patient. Now, let me ask you a question. If, let's say, your medical director, or let's say the minister of health, or let's say the president of your country walks into your medical facility, whether as a scientist or as a nurse or as a service, how will you handle such a person? Definitely you want to treat the person well. Definitely you want to show courtesy. Definitely you want to show support. Definitely you want to ensure that the person is comfortable. Why? Because of his personality. You want to treat him anyhow. But let me inform you that the MD of the organization is not actually the boss of that organization. The boss is actually the patient, because the patient pays the bill. The patient is the essence for creating that services. So the same way you'd have treated the president if he walks into your station or your workspace, same way you would have treated your medical director or your managing director, that is the same order of respect, care we expect from a service provider. Now, it is the duty of the healthcare management to ensure that systems are being put in place to deliver this patient satisfaction. This patient satisfaction, as I said, is not an ideology, it's not a badge, it's not a sticker, but it's a core, is the core for the whole business. Now, when we talk about healthcare management, patient gets good satisfaction when they have full assurance that their user healthcare facility, whether it be a lab, whether it be a hospital, follow quality practice, and that the results they produce are accurate and reliable in an atmosphere that is customer centric. Now, let's use the lab, for example. Now, I want to talk about the quality of a result. The quality of a result is determined by the accuracy of the result, the reliability of the result, and the timeliness of the result. Those are three things that define the quality of every result. So, just as it is. Now, the efficiency of the services in an atmosphere that is what? Customer-centric, in an atmosphere that is business-minded. Some of us here may find ourselves, we work in government facilities, especially in Nigeria, where the healthcare systems are not organized. People do what they do. People talk to patients the way they do, people treat patients the way they do without and get scot-free with it. People can think that the patient is helpless. Now, Philip Crosby is a quality expert. He defines quality practice as meeting the requirement of the customer. In other words, meeting the requirement of the client or the patient. He applied this practice to business and manufacturing, said that this principle is equally important for the laboratory or any healthcare delivery. So you are doing quality practice, not by the definition of the equipment you have, not by the definition of the quality control you are running, not by the definition of the consultant you have, but by the definition of the requirement of the patient. That is quality practice. So you don't define the practice, the patient, you don't define the quality. The patient defines what? The quality. Now, when we talk about, let's look at some things that enhances the patient journey. Now, one is professionalism. I used to say that a professional is not someone who studied a professional course. A professional is someone who practiced excellence and delivered quality in his choosing area of field. So you can be a medical doctor. If you are practicing quackery, we'll call you a quack and not a professional. You can be a medical scientist if you are practicing substandard process. You are not a professional. While we can have somebody who is a shoemaker or a shoe mender, whatever you call him or her, and he's doing it according to what the requirement, excellence, putting in his excellence, we can call that person a professional shoemaker. So one of the things that enhances the patient journey is professionalism. So it is required of every healthcare professional that they exhibit what? Professionalism. Other thing that enhances the patient journey is productivity. Productivity. Productivity has to do with what? The quantity, the quality, and the efficiency. Quantity has to do with a lot of tasks being accomplished. Quality has to do with the excellence of the finished work or the excellence of the required output. While efficiency has to do with when little effort is being wasted. Now let's say, for example, when we're talking about efficiency, an organization used to, the waiting time for a patient to see a consultant is usually maybe average waiting time is 1 hour. And we put in logistics, put in system, maybe put in a queue system and the rest. At the end of the day, it takes the patient averagely 15 minutes to see a consultant. That is efficiency. You are now more efficient in what you are doing. For example, now a laboratory test that takes 6 hours or 24 hours to run initially, now take the lab 3 hours. That is efficiency. Little effort is wasted. Quantity, quality, what, and efficiency. Other things that defines or enhances the patient journey include the ambience. Gone like those days where people should walk into a facility, a government, I say facility, a healthcare facility, and begin to look the facility like a hut. As a healthcare provider, your ambience must represent your brand. We no longer operate hospitals, we no longer operate labs like shrines. They should what? Be a place where people come and feel homely. Other include technology. No, not technology now, automations. Automations enhances the patient journey, because the truth about it is that when automations are being put in place, what used to take people like 3 hours, 6 hours, begin to take them 30 minutes. Like, remember those days in the lab when the patient comes for, let's say, electrolyte, urea creatinine, liver function, or what other tests, maybe lipogram, and the rest. You see, they take the first sample to the first bench. Someone does electrolyte, someone does urea creatinine, someone does lipogram, someone, at the end of the day, waiting time. But with equipment like this, you can easily just put the patient sample, program it, the next 30 minutes, the patient gets the result. You don't even need to be entering it manually. You transmit it in with an LIS, and the result there, minimal error, maximum what input. So these are things that enhances the patient journey. Others include technology. Technology. Every healthcare service that must deliver patient satisfaction must be driven by technology in this age. You can't continue to be doing manuals and basically, and you don't want to invest in the technology, and you expect to have patient satisfaction. No, because the world has gone global. The world is now information driven. The world is now tech driven. So you must have technology to enhance what the patient journey. Next, in the patient journey, you must have accessibility to service. Accessibility to service is key. These are one of the key areas that define the patient journey. How accessible is your service? These days, people can be in the comfort of their home. Thank God for COVID, can be in the comfort of their home, order a test, order to see a doctor. At the end of the day, they walk in straight and they have everything. Next is interpersonal aspect of the care. A lot of us as professionals, we lack interpersonal skill. We are good when it comes to the technical, but to relate to people, except some of us that are trained, people that are trained to be friendly. You see people talk to clients the way they can't communicate. They can't, even when they communicate, they don't communicate the right vibes or the right information to the client. So interpersonal skills, aspect of the care, interpersonal skills and interpersonal aspect of the care at every level must be there. Talk about technical aspect of the care, technicality. If you're a nurse, you should nurse well. If you're a medical lab scientist, you should do your job well. If you're a doctor, you should doctor well. Whatever that is your technical aspect, we expect professionalism. We expect quality, nothing less than quality. I posted on my timeline yesterday, and I got some reaction. People were like, I was asking, okay, I asked someone, how are you doing? How is the work going? Say, well, I'm actually trying to deliver. I said, no, we did not hire you to come and try. We hire you to come and deliver. That is it. So if you take the job, irrespective of the salary, we expect you to deliver. Delivery is key. We did not call you to come and try. You were hired to deliver. Talks about patient education and patient information. We must continuously educate the patient, inform the patient, for them to have a good and memorable patient journey. Am I communicating?
Yes, you are, sir.
Okay, thank you. Now we'll talk about patient satisfaction. It is worthy for us to note that a good customer service begins at the top. When I mean the top, begins at the management. If your senior people in the organization do not get it, even the strongest link further downline and can become compromised. So customer satisfaction does not start from the reception. Customer satisfaction, patient satisfaction, or customer service does not start from the lab, does not start from the nursing station. It starts from the top. This is according to Richard Branson. We all know him. Now, as healthcare managers, as healthcare professionals, we have to be patient with the patient who are not patient. Did you get that? We have to be what? Be patient with the patients who are not what? Patient. That is why they are called patients. Nobody wants to come to the hospital to come and have 1 week holiday. Nobody comes to the hospital or come to the lab to just catch fun. Even when they come for checkup, they are expecting something, either a good report or something else. So nobody comes and for vacation. Have you ever seen somebody say, okay, I'm leaving my house today. I'm going to EHA Clinic to go and spend vacation for 2 weeks? Nobody. Unless you have 100% customer satisfaction, you must improve. You must keep improving. Because the patient satisfaction is not a destination, it is a journey. Now, I'll give you an example why you must improve. How many of us know Nokia? Now, there was a time we all know Nokia, that Nokia was one of the best brands when it comes to phones and accessories and the rest of. And Nokia saw themselves as one of the big shots, which they were actually there. And there's a department called in Nokia called the they call it the research and development arm. It's a department, and the management decided to stop the funding of that department, and that is how they stopped meeting the customers' needs. And over a time, Nokia was bought. The day the MD was handing over, he was in tears. Why? Because they failed to understand that the customer's satisfaction is not a destination, it is a joy. You must keep improving. And that is why in quality management system, which is one of my area, is quality improvement program. It is the largest room, the largest vacancy. Now, this is a quote for me. I said the goal as a company, it should be to have a quality service that is not just the best, but it's called legendary. And this is the responsibility of the management to drive the vision. It's the responsibility of what? The management to drive the vision. If you study any program or any organization that has stand the test of time, you understand that the customer satisfaction do not actually start from the middle, it starts from the top, from top to bottom. I'm going to understand what I'm talking about. Now, the next is the healthcare management tool. Let's look at some of this healthcare management tool that could help to deliver the patient satisfaction we are talking about. Now, look at this. For a quality management system, you must have continuous improvement program. First, okay, let me start from, no, not continue. Let's start from the defined business process. So every healthcare facility must define their business process. What are the process? What are the steps? What are we out there for as a healthcare brand? So definition of the process determines the outcome. Next, there must be a management responsibility. If the management is not responsible, forget it. There is nothing that can happen. And that's the reason some facilities find it hard when it comes to accreditation. Why? Because the management is not interested. So there's nothing the employees can actually do. Next is customer focus. The organization must be patient focused. I won't talk about customer focus. I will talk about both internal and the external customers, which include also the patients. Next, they must learn how to do what we call resource management. Any organization that cannot manage resources judiciously definitely cannot satisfy their patients. You pump in money, you pump in investment. At the end of the day, those investments go down. Resource management. I won't talk about resource management, both material, both personnel, everything are inclusive when it comes to resource management. Next, there must be a service provision. Next, they must continue to monitor and measure the outcome of their service. Where there are no monitoring and measurement, there will always be a deviation. People only do what you monitor. If you don't monitor, you don't. That's why in NGOs, in big projects, you can't have a project without an M&E. Next is customer feedback and satisfaction, which is the bane of what we are doing today. So you must keep having any organization, any capacity that does not have an avenue to keep getting a feedback from the patient, from the customer, and their satisfaction, you are heading nowhere. And next, you must continuously improve. No matter where you find yourself, no matter how efficient you are, accreditation is not the bus stop. It is the beginning of the journey. You know, in developed countries, when a lab or a facility had an accreditation, it is just a prerequisite to actually do the business. But in this part of the world, it's like an attainment, it's like an achievement. No, it's not an achievement. It is the beginning of the journey. Now, we talk about quality leadership. Quality leadership or leadership quality. So the healthcare management to deliver a patient satisfaction must be that is inspirational. They must be honest. Now, there is what is called expectations. There's an expectation between an employee and an employer. There's an expectation between a husband and a wife. There's an expectation between the leader and the follower. There's an expectation between the politicians and the citizens. It is an expectation that brings about unsatisfaction. It is an expectation that brings about disgruntlement. So we, as in the quality, the leadership, one of the qualities they must execute is what? Honest. They must be honest. Honest to the patient, honest to the employee, and honest to themselves. They must be highly committed. Highly committed. And that's why if you see the ISO technical document, you see that the management commitment or requirement is far more than the technical requirement. Trying to show that they must highly be committed. In fact, their commitment must be in the front burner. They must be passionate. They must reflect it, they must be reflected and decisive. Any leadership, any healthcare management system that is not decisive will never make progress. Because indecision itself is a decision. Am I communicating? There must be creativity. There must, the leaders or the leadership must be a problem solver. And you know, a lot of us, when I'm talking about, I say, after it doesn't concern me. I'm just a doctor in this facility. I'm just a medical scientist. No, leadership is not positional. There's what called positional leadership. There's what called true leadership. So wherever you are, you must lead from where you are. You don't need to be in position before you lead. So that's why when I work with people and they keep complaining, this is not working, this is not working, this is not, the question is that what is your idea? What is your suggestion? I don't know. No, you are not a leader. You don't have the leadership quality. The problems are obvious. We don't need to look for the problems. But the question is that what solution are you bringing? And that's the reason you were hired. You would have hired an equipment to do your job, but because you have a brain and you can think, that is why that's why some HR will ask, what are you bringing on board? If you go to any interview and you are asked, what are you bringing on board? One of the things I expect from such a person is, if I hear that I'm a problem solver, I like, seriously, there is nobody that want to hire you. Why? Because there's problem everywhere. It's problem. There is no perfect organization. There problem will always arise, but we are not looking for people who will come and complain and tighten the bags. We are looking for people who will bring solutions and solve those problems. And in solving problems, that's how you grow. The leadership quality includes they must be supportive. You must show empathy. There's a difference between empathy and sympathy. Empathy is putting yourself in the patient's shoe. Some of us will do sympathy, not empathy. Am I communicating?
Yes, you're communicating. You are.
Okay. Now, part of the leadership include what? They must be goal-oriented, they must be successful, they must have contribution, they must have teamwork, motivation, and support. If any leadership of any team does not possess these characteristics, that team is going nowhere. There's what we call team formation. You can read it up. In team formation, there come a time where the team does not understand where they are going, but it will take leadership to find them out. They are normally stormy face before they start performing. Okay. Now, let's look at these tools. Now, remember, we're talking about some tools that could help the healthcare management to deliver what? Patient satisfaction. So among many things that I have discussed today, in terms of like these tools, leadership quality management system, leadership, and the rest, I want to introduce a tool that if applied anywhere, whether it be in manufacturing industry, whether it be in healthcare, whether it be in automobile, whatever industry you find yourself, if you can understand this concept, understand this tool, you can satisfy your patient or you can satisfy your client. It is a master tool that has been proven and that has stand the test of time. Time will fail me to tell you about the history of total quality management, but I will just go straight to this tool and explain it to us. Please open your mind and hear me, because we are coming to the critical part of this webinar. The TQM is a systematic, encompassing, and participatory approach to planning and implementation of a quality management system for an organization continuous improvement. In other words, it is like a management tool. So that's one of the difference between TQM. People ask me, what's the difference between TQM and QMS? So TQM is a management tool that is systematic, encompassing, and participatory approach to planning and implementation. We all know that without implementation, planning becomes what? Void. Of quality management system for an organization continuous improvement. And we know that quality management system are a set of coordinated tools, resources that help to maximize profitability and address. So this TQM focuses on process improvement, which is key to patient satisfaction. It focuses on meeting and exceeding the customer's need or the client need or the patient need, as whatever you may call it. So TQM identify problems and fix it. So the quality system refers to the organizational resources, their process, their procedure to implement what? A quality management. That is a quality system. So any organization that does not have a quality system cannot meet their patient demand or cannot satisfy their patient or their client. You can quote me anywhere, whether you be in a fashion house, whether you be in engineering. If you don't have a quality system, I tell you the truth, you can't meet it up. So quality system refers to the organizational resources, their processes, their procedures to implement what? A quality management. Now ask yourself, does my organization have a quality system? Next slide. Now let's talk about the principles of total quality management. Please open your mind as I take you through this. So we have basically 8 principles. Am I communicating?
Yes, you're communicating. I can hear you loud and clear.
Now, these TQM principles were derived from ISO 9001-2015. So these principles form the foundation of the different ISO portfolios of quality management. We have over 2,000 to 3,000 ISO standards that is particular to different industries and the rest. So they form the basis of what we call the good laboratory practice, the good clinical practice, and a good manufacturing practice, where we have the GLP, GCP, GCLP, and the GMP. Now, principle number 1 talks about customer focus. You can say patient focus. So this principle deals with that. The organization establishing a customer focus by understanding the need of their customer, meeting their customers' current and future need and expectation. It's not in this slide. I'm just saying it so you get it. So what is the principle? It deals with the organization establishing a customer focus by first doing what? Understanding the need of their customer, meeting the customer's current and future needs and expectation. That is what took Nokia out of the market. Evaluation of this principle. 2, leadership. When we talk about leadership, that it says an organization will succeed when the leaders establish and maintain an internal environment in which the employee can be fully involved in achieving the organization's common or unified objective. In other words, until there is leadership that is provided within an established facility or an established company that maintains an internal environment. I'll talk about internal, where the clients, where the staff, where the people who are working, they must be fully involved in achieving the organizational common goal. So in other words, just as I said earlier, everything falls and rises on leadership. So no organization can grow beyond the leaders of that organization. So where the leadership stop, that is where the growth stop. Am I communicating?
Yes, yes.
Number 3 principle talks about involvement of people. In this state, that the organization succeeds by retaining competent employees, encouraging continuous enhancement of their knowledge and skills, empowering them, encouraging engagement, and recognizing achievement. I take that again. Involvement of people. State that the organization will succeed by retaining the competent employee. We all know what is happening in Nigeria today when it comes to what? Healthcare, human resource. Very soon, I don't pray for that, but you will walk into some government facilities and you not see a healthcare professional. Why? Because what? They are violating this principle of involvement of people. These QMS principles. So it said the organization will succeed. You know, when you have a high rate of staff turnover, you know how the department looks like. Oh, we are just training this person, as we are training this person, you hear that this person has traveled, you hear this person has jackpot, you hear that this person has gone to another facility. At the end of the day, we start over again. That's when you begin to have errors, you need to have issues, you need to have people who don't understand the company's culture. Because cultures are not built overnight. Number 4 principle talks about process approach. This principle entails that the organization enhances their performance when leaders manage and control their process as well as the input and output, and tie them as this process together as one process or one coherent quality management system. That's process approach. Let's say, for example, now you walk to EHA Clinic in Kano, as you have the same services as the EHA Clinic in Abuja. That is process approach. If you go to McDonald's South Africa, the same way it tastes should be the same way McDonald's America should also taste their burger, whatever it is. That is process approach. So the organization will enhance their performance when the leaders manage, hear the word manage, control their process as well as their input and output, and tie them, this process together, because it's the quality of the input that determines the quality of the output. If there's a defect in the quality of input, definitely there will be a defect in the quality of the output. So we can know how the output of a service will be with the quality of input. That is the process approach. Number 5. Am I too fast?
No. Yeah, no, the speed is normal.
Okay. Next is system approach to management. Okay. An organization will sustain success when the process are managed as one coherent quality management system. So if as a healthcare facility, your quality management system for a particular location should not be different from another location. Even at the processes, even the system should be the same. It should be replicable. So the organization will sustain success. Remember, to sustain. apart from the control, they must be managed as one coherent quality management system. So one organization with two different locations should not have two quality manuals. Should not have two visuals, should not have two different SOPs on a particular process. Number 6 talks about continuous improvement. I like this. I love it. Now, it said that organizations should maintain the current level of performance, respond to the changing condition, identify, create and explore new opportunities when they establish and sustain an ongoing focus of improvement. In other words, at every point in time, there must be a continuous improvement program for a unit, for a location, for an organization. So we're saying that you should maintain your current level of performance, but respond to the changing condition. Now, let's say, for example, a lab, let's use a diagnostic center. Before COVID, we could count how many facilities in Nigeria that has a molecular unit and the rest. And there came a time where people needed to do COVID testing. And you remember that during the COVID time, any lab that was not into the COVID business, you were not actually in business. Two of us. Two, because of what? The changing condition. So as a healthcare service, we must respond to the changing condition. We must identify, we must create, we must explore new opportunities when they are established and sustained in the ongoing focus of improvement. Number 7 talks about factual approach to decision making. This is one big thing that most African leaders don't do. This principle opines that the organization will succeed when they have established an evidence-based decision-making process. This entails gathering input from multiple sources, identifying facts, objectively analyzing data, examining cause and effect, considering potential consequences. So we don't make decisions based on feelings, based on emotions, or based on what we feel like. Whatever decisions that we are making must be evidence-based decision-making. Fact. Oh, you're asking me to bring in a particular equipment, a particular services. What are the data that is pushing for this particular service? That is evidence-based. Some persons open a new facility just because they are from that hometown. And those are not factual. When we say factual, it's really facts. Factual approach to decision making. So every decision making must be based on fact, must be data driven. Am I communicating?
Yes, you are.
Yeah. So the principle opines that the organization will succeed when they have established an evidence-based decision-making process. This entails gathering the input from multiple sources, that is researches, identifying facts, objectively analyzing data, examining cause and effects, and considering the potential consequences before the decision is being made. So the next is what? Mutual beneficial supplier relationship. Then the organization that carefully manage their relationship with suppliers and partners can nurture a positive and productive involvement, support and feedback from the entities. Suppliers and partners are very, very important when it comes to any business process, or when it comes to meeting the patient satisfaction. Am I communicating?
Yes, you're communicating.
Okay, now this principle we have shared, this 8 principles, are not just the backbone of quality management system. They are simply good business principles to put into practice across any enterprise, across any business, across any organization. Hello, can you hear me? It's in the network.
Yes, we lost you, but I think you're back now. Hello?
Hello?
Yes, we can hear you. You cut out, but I think you're back now.
Yes, I'm trying to share the slide.
Yeah, it's okay.
Okay. So can you see my slide?
Not yet. I guess it's coming up, but not yet.
Okay. Let me try. Okay.
Okay, it's
So
coming
can
up
you see
now.
my slide now?
Yes, yes.
Okay. So I've discussed this extensively, and the next is the quality system essentials. A lot of people don't know the difference between the principles and the essentials. So the principle is what I discussed just now. This is the essential. When we're talking about the essential, we're talking about the organization. So every healthcare institution must understand the requirement of an organization, both from legal requirements to how the company should be organized, to the functions of the different organizations and the rest. We talk about personnel management. Personnel is one of the most important quality system essentials because every other system essentials are driven by personnel. So if you are putting square peg in round holes in terms of your personnel, definitely you can't achieve patient satisfaction. If you're having unmotivated staff, there's no way you can achieve what? Patient satisfaction. It takes a satisfied internal client to satisfy a patient.
That's right.
Take it or leave it. Now, we talk about equipment, talk about purchase and inventory, talk about process control, information management. Quality of information management has the way of driving what your quality, your satisfaction. Now, these days, people go to places and maybe they are doing their test, radiology, and the rest stuff. And you can get everything on your email. Can get everything can be sent to your doctor. Those are part of information management system. Documents and record, occurrence management, assessment. Don't talk about assessment, accreditation, audit, and the rest. Process improvement that I've discussed. Customer service, facility, and safety. Very, very important. Now, let's look at the ways of assessing and monitoring of patient satisfaction. How do we assess patient satisfaction? How do we monitor patient satisfaction? First, through complaint monitoring. You can have a complaint form or a tool, a feedback tool. You can use to monitor your patient satisfaction. Next, two quality indicators. Now, I talked about that patient satisfaction can be described as a quality indicator or can be used as a quality indicator. Quality indicators are what? Let's say for now, how can you use patient satisfaction as a quality indicator? Now, let's say for example, now you set a particular department that in radiology, we don't want to have last year we have 20 complaints that centered around this and that and that and this. You can now say, okay, in 2023, we want to have nothing less than, not more than 10. Last year we had 20, but we are setting that this year we don't want to have any not more than 10. If at the end of the year or at the end of the point of review, now you have 11, you have not met that indicator. Though there's an improvement, but that indicator failed. Let's say for the lab, let's say we are using proficiency testing. Okay, so at the end of the day, we want to have 95% proficiency testing pass for our EQA programs. That is a quality indicator. But here, when we talk about patient satisfaction as a quality indicator, so you need to gather your patient information. That means you have to be doing a monthly survey or at least a quarterly survey. You could use any of the method. You could use SurveyMonkey, you could use the manual forms, you could use a feedback system, whatever it is. So you can set it as a quality indicator. The complaints, the satisfaction, the thumbs ups, and the rest. Internal audit. So through internal audit, you can. I don't need, if I go into a facility and I do an audit, I don't need to tell you whether your patient are satisfied or not. With the audit, I can tell you that things are not working well. I don't need to even see your complaint register. And complaint register is part of the requirement for an internal audit. You can't say you have a system, in this country, you need developing countries or what we call it, developing country, and tell him that there's no complaint. Now, are you that good? Next is management review. These are ways of monitoring patient satisfaction. There should be minimum at least one management review for every healthcare organization per year. I used to advise for a growing organization, you can have up to like 2 in the year. But minimum requirement for the quality standard is what? Once a year. And there is what must be covered. It is not all those kind of there is requirement that must be covered in a management review. Management review is not the kind of those meetings we go and we are talking about only money, talking about to make more money. No, there are things to talk about, the quality indicator, talk about the audit, talk about accreditation, talk about a lot of the process, everything. It's an extensive meeting that must cover all the aspects, every location. Next, we talk about satisfactory survey. So they must have satisfactory survey being done. You can do monthly, you can do quarterly, at most quarterly. Should be so that you get to get feedback. We have what's called interview and focus group. You could interview some set of people about your services, about how they feel about it, and some focus group, a particular age, a particular service, a particular people to get feedback. Can you see this?
Yes, we can. As you zoom. Yeah.
Okay. Okay. Now let's look at the quality of the healthcare service, key components. I just took some based on, let's use one. Don't mind me, I'm biased about the lab. Laboratory testing. Key component of the quality of the healthcare service. Remember, the quality of the healthcare service also determines the patient satisfaction. You can't take the service away from satisfaction because the service is the output. Let's say, for example, a client walks into your lab. Now, I'm talking about lab testing here. He gives you money, or his HMO, gives you his blood, gives you his sputum, gives you urine. The only thing the client gets from you is what?
Results.
Your result. The result. And if that result is not accurate, is not reliable, does not meet the time, definitely it becomes a mere paper information. Of what is your lab result when someone is needing a lab test to go for a surgery, and the person has gone to the surgeon and he's coming back, that's when you are bringing a report. It becomes a mere paper information. Or let's say, for example, they needed the report to commence treatment. And at the end of the day, the person passed on. That lab result is just a mere paper. I used to tell laboratory personnel that when you see a sample, let's say a urine sample, a blood sample in front of you, it's as good as a human being. Now that's what we say in the lab. We take care of the patient even when the patient are no longer there. That culture you are doing, you are taking care of that particular patient. Now, just let's say a consultant pediatrician that wants to see a baby. Are you getting? And maybe he has 10 babies in front of him, and his consulting is outside. You hear the baby crying, they want to see. The same way that baby is crying in waiting for the consultant, that is the same way that sample of baby will be in your decks. It's also crying for your attention. So if you cannot appreciate it that way, then there will be no sense of urgency in what you do, irrespective of the urgent sticker they put. So until you begin to see that sputum as a human being, until you begin to see that urine as a human being, as a lab practitioner, you are not getting the key to it. So routine and safe analysis, advanced diagnostic, method development and validation, analytical expertise, accuracy, reliability, and timeliness of the results. These are key components when it comes to laboratory testing in healthcare service. Now, other aspects include investigator support. You have to have real-time query support, customer service support, trainees, 24 hours customer service if your organization is big enough, online client booking system. I don't need to walk into a facility before I book for a service. I should be able to do that from the comfort of my room. Dedicated staff, manual instruction. These are things that support what the healthcare services. Talk about like sample management, study specific kit building, package label controls, kit inventory, monitoring, planning, tracking, reporting, and ambient, refrigerated, whether frozen items, vendor management, and the rest. They are all part of what? Sample the management and support. Talk about quality management system. Quality manual. If your organization does not have a quality manual, you don't have a quality system. You can quote me. You don't have a quality manual, you don't have a quality, you don't have a quality, you don't have a safety manual, you don't have a safety program. Forget whatever you are, forget the lab coat you are wearing, or the world coat you are wearing, or you don't understand it, or you have not come across it. Accreditation, personnel training, external quality assessment, validation, management requirement, technical requirement, quality system essentials, all these form the building blocks for the quality management. Talk about information technology, good laboratory information system, health record, healthcare apps and delivery, user-friendly and high-speed technologies, IT innovation and expertise. A lot of people are like, some of you maybe, and this can be a good career path for someone. Maybe, for example, you are thinking, oh, I'm tired of the routine. Why not? Why not? If, for example, now I'm to design a health record for a particular reason, do you know, with my expertise as a healthcare professional, I will be able to do better than someone who just did computer, who just learn only code, who learn only those stuff. So your expertise, if you bring it into technology, it can also form a good career path for you. You need to know how much a good alliance costs. You need to know how much some of this technology costs. So you are already in good business already. Health records, good LIS, healthcare apps, delivering user-friendly and high-speed tech, IT innovations, expertise. Some of them you can improve on them. Some of them you can come with something new. That's innovation. That's creativity. Am I communicating?
Yes.
Now, I want to talk about management responsibility. Remember, I said that management responsibility is key. First, you must build a framework for patient satisfaction and management. Without a patient management system, definitely there is no way the company or the organization is going to meet the patient satisfaction. Where there are no framework, where there are no system, definitely there will always be a breakdown. Organization does not succeed by building on people, they build system and people implement the system. If you build on people, when the people leave, everything falls flat. When the person did not come to work, nothing is being achieved. But when you build system, people are driving the system, then there's effectiveness and there's efficiency. Next, you ensure that staff are well motivated. Ensure that what? Staff are well motivated. There must be a customer service policy. Next, you must share the vision and cascade it down. These are management responsibilities. The team needs to develop objectives that derive from goals. They should be able to provide resources, and there should always be a management review to review what? The policy, to review the framework, to review the vision, to review the activities, and to help implement what resources into the right channel. I hope I'm able to break some of these things down for us to be able to grab and get as much as possible. Now, what are the benefits of the patient's of patient satisfaction? It helps the patient journey. Next is save costs. When patients are not satisfied, they spend more. Let's say, for example, now a client is expected to get a result to see his doctor. At the end of the day, maybe the consultant comes only once in a month. At the end of the day, the result is not ready. Or what happened? The person will need to come back again. And I know some people in this country that travel from one region to the other region to get some healthcare services. Or let's say a services that does not meet the client need. The client will need to go to somewhere else to go and do that. That is cost. So when patients are satisfied, you will help them to save costs. It can also increase the lifespan of the patient. Next is help for client or patient retention. Whether you like it or not, if only the patient you see in your organization, your company, or your facility, they are only one first-time visitor. When they visit, they will not come back for a repeat visit. You are not going anywhere in terms of your clientele. It helps your brand. People say, go to EHA Clinic. Go to so and so hospital. Go to this people. Why? Because of what? The satisfaction. So it increases your brand. Somebody says, hey, don't go. See, for every one client that is not satisfied, they go and tell 20 clients. Every one client that is not satisfied from statistics, they go to tell minimum 20 clients. But the one client that's satisfied can tell me maximum of 3 or 4 or 5. It helps you to enjoy good referral as a company and an individual. It helps in sustainable healthcare. If we must sustain our healthcare system, we must begin to be what? Patient focused. It attracts investors and collaborators. There are some investors that they will never invest in your business when they know that you are not meeting, you are not continuously satisfied. Everybody wants to be identified with something that is growing and something that is good. If you must, as an organization, as a growing company, as a growing business, you want to attract investors, you should be patient focused. You should be customer focused. It helps to reduce patient burden. The patient is burdened already. So when they are satisfied, it has to do what? Reduce what? Patient burden. A lot of stuff, a lot of benefit when it comes to patient satisfaction. It helps also in the accreditation process. It helps also in meeting regulatory policies. Time will fail me not to put everything on this slide, but that's the reason. That's different between you that with someone that will have this slide and someone that is hearing what I'm going to be saying. So it helps for accreditation purposes. It helps to meet regulatory purposes and the rest. So there's so many benefits that are attached to when an organization is meeting their patient's demand. Remember, the essence of the business, the essence of the healthcare delivery for the patient. So both the management and the employee must understand that the whole reason why we are there is because of what? The patient. So we must do everything within our possible means to put the patient as top priority before any other person. I'll discuss this on a few days. I'll do it. I told them in the order of decision in healthcare, the first person should be the patient or the client. The next should be the organization before your team, before yourself. If you reverse this order, you mess it up. You miss it. So the first is the patient. The first is the client. The next, before you talk about every decision should be centered on how to improve patient satisfaction. If it will not improve patient satisfaction, then that decision is not a quality decision. So when making decision, when implementing a program, when implementing a project, ask, does it increase our patient satisfaction or it decreases our patient satisfaction? If it decreases the patient satisfaction, I can tell you that it's not that is one way to know whether it's a good decision. Very sure indicator to know whether it was a good decision. Now, by way of conclusion, now before I conclude, I'll make some recommendation, which is not on this slide. I probably didn't put it on this slide. Now, the fact that you are a health expert or you're a technical expert does not make you a good healthcare manager or does not make you do well. Some of us as healthcare experts, we are very poor when it comes to decision making. Some of us are very poor when it comes to expertise. Not expertise, you are poor when it comes to basically decision making. Where some of us are poor when it comes to interpersonal skills. Some of us are poor when it comes to entrepreneurship. Some of us are poor when it comes to customer service. Some of us are poor when it comes to leadership. So it is encouraged that every organization that must satisfy their patient must satisfy. That's the first recommendation. You must provide, one of the principles, you must provide a convenient environment that will help the internal client, the staff, to do what? To meet the patient. So we must create, that's why I used to talk about workplace communication. It is not everything you say within the workspace. You know that we spend more time with our colleagues than we spend with our spouse, with our husband, with our friends, and our guys, and every other person. So we must create a convenient environment that helps us to grow the business, that helps us to satisfy the patient. That's the reason why we are there. So we must create, one of my recommendations is that we must continue to create an internal environment that will help us to meet the patients as well. We must increase in our continuous education. When you're continuous education, not just only to do masters, PhD. awareness, information. So sometimes you can be within a department and discuss some of these things within a department, within an organization. And that's one of the reasons what we are doing here. So you have to address this continuously, and it helps the organization, help the team to be focused. Other aspect of the convention is what we must leverage on partnership to satisfy our patients. Now, the conclusion, the patient satisfaction is the totality of the experience of the patient journey, the healthcare delivery. And if it is not good enough as expected by the patient and the regulatory body, then it is not quality. It is the responsibility of the healthcare managers and the team at large to provide a service that will continuously meet and exceed what patient expectation. Thank you. Any question?
Yeah, I should start with a round of applause for you, sir, Mr. Dr. Aliyu Israel. Thank you for this very elaborate and insightful delivery. I'm sure it seems like you had much more to say than was even written down, and I'm sure that our listeners must have found a lot of useful information here presented this evening. So while we wait for our questions, I hope we're not leaving with the impression that all that has been presented here is for managers or for administrative alone. I think if that is your conclusion, then you, thank God this is recorded, you will need to listen again. And one of the major points he made, which I saw in a book, 360-degree Leadership, was that you can lead from any position. And another very important take home is that perhaps some of us who have not started establishments will still start tomorrow. And so you're building your portfolio and repertoire of knowledge and to go on. And something I learned again this evening is we should not just go for knowledge, but seek for actionable points. So at our level of influence, at our sphere of influence, there's certain things you can implement from here. So the recording will be shared after this meeting, so you can hear and hear and hear until we can internalize the principles that have been shared. So please, are there any questions? I've been looking at the chat box. If you have a question, perhaps you've dropped it before, maybe you can bring our attention to it again. So on the chat box side, a lot of people are appreciating and commenting. The feedback is that it was a very impactful session. I think you did very much justice to it. You shared with us your wealth of experience. You know, the profit for some of us, for when we listen to people like you, is that what you must have gathered years to learn, what you would have paid so much to get, in one sitting with you, we have traveled all your years of learnings and experience. Thank you very much, Dr. Israel. Are there questions? I'm looking at the chat box. Any questions, team? Let me see if you would want to speak. I can grant you the opportunity to maybe raise a hand. Let me see.
Hello, good evening, sir.
Yes,
hello.
Good evening. Yes, good evening.
Yeah, this is Mapak Julius Philip. We are very grateful for this wonderful opportunity. My question is, please, can we have access to the slides of the presentation? Thank you.
Okay, thank you, Mark Philip, for your question. Nandom Tashin. Okay, let me see.
You can chat me up on my WhatsApp if you have any other question, information on my mentorship program, capacity development programs, trainings, and consultations. You can reach me on this WhatsApp, any of this WhatsApp number, or my email address, and however.
Okay.
Okay, thank you very much, sir.
Yes, please go on.
Okay, sorry. Yeah, good day. Am I audible?
Yeah, okay.
Okay. Okay. I just wanted to ask, how do language barriers affect patient satisfaction in an organization?
All of us.
Dr. Israel, did you hear that?
I didn't get that.
Okay, I just wanted to ask, how does language barrier?
What?
Language
You
barrier.
wanted to know how barrier
Language
could
barrier.
affect patients.
Well, for language
Yes.
barrier, just like, let's say, for example, now, if I am I'm a pharmacist, and the drug has been prescribed, I'm to give you the drug, and you don't understand English, definitely there's no communication. So it affects it because of breakdown in communication. So when there's a breakdown in information, or when there's a breakdown in information as a result of language difference, definitely there will be a disjointed information. When there's a disjointed information, there will be no compliance. So we must strengthen. So if you work in an area where there's restrictions in languages, or work in a rural setting, definitely you have to look for a way to communicate your information, either through sign, or through getting the person to understand, getting an interpreter. You have to ensure that proper communication and patient education is part of the building blocks. I mentioned it there, patient education and patient information among some of the tools.
Okay.
So have I
Thank
answered the
you.
question?
Yeah, okay, thank you. Thank you.
Yes, Ikechukwu, can we hear you now? Hello, Ikechukwu.
Hello?
Yes, please
Can
go
you
on.
hear me now?
Yeah, clear.
Hello? Yeah,
Yes,
I
go
said
on.
they've actually asked what I wanted to ask. Are you with me?
Okay.
Hello?
You're saying
Hello?
your
Can you
question?
hear me?
Yes, we hear you.
Oh. Hello?
Please go on,
Hello?
we can hear you.
Okay, I said the last speaker had actually asked what I wanted to ask. And actually, I think is a major challenge in customer satisfaction, most especially when it comes to do with aspect of the laboratory, where maybe you might have some patients who walk in and possibly you have to attend to them in the lab, and you need to explain what they are to do in details in order that you seek their consent. So most times, for sake of language barrier, the message might not really be passed, and it becomes, I don't understand and all. So it's actually a challenge sometimes. It's challenging, but I think the best advice I have is maybe calling on someone who understands the language very well, or who knows about the language, or who can speak or interpret the language much more than yourself, to attend to such a patient who cannot understand English. So thank you very much.
Okay, thank you very much. I see a question in the chat box. Thank you, Dr. You sometimes, no matter how professional you conduct yourself, some patients relative will get you angry. My question is how does one manage such occurrence? I remember you said be patient with the patient be patient with the patients who are not patient. I think that was a very powerful one. So, so do you have thoughts to share with us on that, sir?
Okay, now, however, it's not everything I can actually share here. And because now there is what in customer service, there's what is called a subtopic that is called how to handle difficult clients. So you must learn that. We have both what it takes, the internal quality and the external quality. So if we don't know how to manage a difficult client, the patient is not always right. Are you getting me? You can usually say that patients are always right. No, patients are not always right, but they have their right. They are not always right, but they have their right. And they decide where they spend their money, especially in our kind of healthcare financing that we have. So you must learn how to handle difficult patients. Do you know that there's a way you handle a patient, basically, and the rest? Because most of those patients, like I said, it's just like you have to learn how to be patient with those patients because then they say they are not patient. So there are there's what called verbal and non-verbal communication. So you can actually be talking to a patient, and your non-verbal communication is telling that you are telling the patient that it's nobody, and they get angry. So management of patients is key, which we must continue to build. One of it is interpersonal skills. One of it is customer service. A lot of things. A lot of patients can really get angry, can get disgusted, especially when, and some patients can be stubborn. They want you to do what is convenient. So even in a manner that you are telling them what is not right, this is not right, this is right, the way you put it across to them matters. When I was doing my internship, I've had this, okay, I think this is a very good experience, especially when it comes to communication. So I was in blood bank in hematology then. And then after screening the blood, the patient, one of the clients came. The guy was an outside patient. So not outside. Okay, the guy came in and was like, so he brought 3 patients. So I screened them, and so we had 3 pints of blood that we had. So when the lady came, the attendant from the ward came to collect this blood sample. Actually, the attendant is these people, Fulani people that does not understand English. Now, so she came, and I told her to go back, that the blood is not ready, that the blood will be ready in some few minutes. That's what I told. I never even knew that she does not understand English like that. So in a big hospital, I don't expect such a person that does not understand English to be there. In my own thinking then. So you want to go and tell the client that I said that he does not have a blood. So when the guy came, the guy was already drunk, asking with the issues, a lot of things. The guy just poured fresh saliva on my face. Yeah? Wow. You need to see the way I carried that guy that day. I carried him hanging to the wall. As in, they came to separate us. So at the end of the day, that was there. But now, if I have an encounter with such, I know what to do. Are you getting? Because so you must understand how to manage. One of the skills, I just told you just one. You must develop a thick skin when talking to a disgruntled client or a difficult client. So you must be able to absorb. Say, this one that is not even up to my wife. This is not up to my girlfriend. If I was not inside this hospital or inside this lab, can this person come and talk to me this way? So by the time you begin to do that, at the end you lose your sanity, you lose the core essence why you are there. So there are skills. If you want to know, you can come to my customer service class. I can teach you on how to handle difficult clients. But I think I've explained 1 or 2 or 3 about it, and you could take home and also read more about it. Thank you.
All right, we have another question. Adibanjo Habiba is asking. He said, "Thank you for your wonderful presentation. Please, I'd like to ask, in a situation where a physician or patient was given a result which was not in agreement with their clinical impression, makes them to look out for somewhere else. Please, how can one regain the confidence of the physician or patient towards the laboratory results? Thank you." So, sir, we want to hear, this person wants to hear your thoughts.
These are common practice, or these are common occurrence or common event we see, especially in this part of the world. But the truth about it is that, first and foremost, if you are confident of what you have done, there should be no shaking. Let me use that word. Let me use that slang. Now, the truth about it is that if the physician actually knows everything. He won't send for the laboratory testing. He's actually querying that he's not sure. That's the reason he is. Or sometimes he's sure he wants to confirm. Now, so it is the laboratory that determines. That's why sometimes they send a sample for a baby hive is having jaundice. Are you getting me? And they send a sample to the lab for you
to know how to
and direct.
Expecting
Hello?
patient in the lab. Please.
Hello. So
Yes,
now
please.
the patient, the doctor or the physician is seeing the clinical feature of a jaundice. Are you getting from that baby or from that? And they brought the test, and so the doctor or the physician is having his mind around how the result goes to, but it's not really sure, and that's why he says so. First and foremost, how you can restore confidence is that you yourself must have confidence in what you have done. Now, the fact that the lab gives another result that is different from yours does not make the lab correct.
Yeah,
The question is,
right.
do you have a quality management system and a quality control programs and a quality assurance program that ensure that your result is accurate, reliable, and reproducible? That is the main question. So if you are sure of what you have done, but sometimes when they call, what you do, you can review, check your quality control, check your graphs, check your standard deviations for that day. If it's a quantitative testing, basically ensure that everything is done, ensure that there are no transcription errors. Because sometimes you can have something, and maybe the person that is putting it can put something else, especially when you are doing manual transcription. So just quickly review your process for the sake of that, to ensure that there's no error. That's one of the difference between a quality-oriented lab and a non-quality-oriented. In a quality-oriented lab does not guarantee an error-free lab, but it will not allow the error to go undetected. So when those errors happen, definitely you'll be able to detect it within your system. That's what they call it. There are major errors and minor errors. Any error that affects the patient management is a major error in the lab. If it's an error that is picked within the system, it's called minor. So if you are sure of what you do, then you communicate to the client or communicate to the physician. This is what to do. This is what to do. This is what to do. And if over and over again you have been able to sustain your standard and your quality, they begin to use you as reference. So say, no, it's coming from this lab, I trust it. And that's the reason why we encourage people for trainings. That's the reason we encourage people to ensure that your process are standardized. You are using a pipette for 2 years. You are not calibrated that pipette. How are you sure that thing you are pipetting is the right volume? People that are spending money to calibrate, you think they are just wasting their money. Anything you do within the lab space that compromise the patient, the quality of the result is quackery. And let me tell you the truth. If you work in the lab, you don't understand laboratory quality management system, forget your PhD. You are a professional, you are a techo, you are a professional quack. Because you do practice, you do things that, and it is in every profession, it is everywhere. It's not to downplay on anybody. So you must understand the standard, what it takes. Documentation. Some of you don't have traceability in your process. When you document, you don't have a place where you put. So all those sharp practice. I've seen a lot of healthcare facility people that write. I've seen people that write results, not even scientists, so non-medical scientists that work with. They just write results or to get money. So not everything you do that should be done. So whatever that will compromise the patient, the quality and patient satisfaction should not be encouraged. You shouldn't even be involved as a professional. Don't let it be mentioned around you. So when you have something, you should review your process, then communicate to the physician, communicate to the client. By the time you communicate and by the time they're able to put it, they see that you're actually right. That's the way. That's the way to convince them. The fact that somebody have a different result from yours, they don't make that lab right. Thank you.
All right. Thank you very much. Dr. Fashobon is in line. I think he has his hands raised. Can you ask your question? He was one of our presenters in the past. Dr. Samuel, sir.
Okay. Good evening, everybody.
Good evening.
Yeah. I appreciate the presenter, my friend, Dr. Aliu, for the work done so far, at least. has been able to also open our eyes to a lot of things as regard the patient satisfaction. Actually, it's not that maybe I want to ask a question, just that maybe I just want to like contribute 1 or 2 points to what has been taught, maybe as regard the questions that some of the participants ask. And as regard the person that was talking about the issue of language, you know, when we are talking about language, it's a wide aspect, because not even by only maybe talking or this thing alone, is the mode of communication. At least we should be able to communicate to our client in a way that we understand. Like maybe the person that asked the question, maybe, it's not everybody that understands English. There are people that they don't understand English and they are also patient. So what we should do is that we should communicate to our patient in a way they will understand, either in language or in any other way, especially when we are like maybe dispatching result or something like that. And then we need to have a way of communicating with, even not only that, when we are even communicating with them when they come to our facility, we should, especially if you are in an environment where we discover that maybe many people are not really educated. So we need to make our facility or design a method or a way of communicating with our patient effectively. So we should not just assume. So that is that. Then in also in the area of handle difficult client or patient, when we are talking about professionalism is not just like the way we just call it. There are a lot of things attached to professionalism. So especially maybe health professionals or whatever profession where you are. So professionalism is a big word. So when we say professionalism, there is need for us to understand what we call emotional intelligence. Emotional intelligence, the way we relate to our patient or our client, as it has been taught by the speaker, there is need for us as professionals to be very patient with our patients. Are you getting it now? So many of them, it's not just easy for them to be patient. Many of them they are psycho. They have psychiatric problem. They have mental problem. So if you don't know that a patient is having mental problem and comes to you and is talking to you in a way, and you now see whether it's mental problem, my brother, if he has a knife, he might choke you. So there is need for you to be more patient, because you don't know whatsoever any of the patients, you don't know what things they are passing through. You don't know what they are passing through. You don't know the kind of pressure, stress that's on them. So as health professional, there is need for you to have a way of calming the attention. Are you getting it now? So not giving them back fire to fire. So emotional intelligence is very important. You need to know how to read the patient you are dealing with. When you read them, at least if you cannot do any other thing, at least try and calm their stress. Try and calm whatsoever they are passing through. It will go a long way. Are you getting it now? No matter or irrespective of the way they talk to you, you have to have a way of understanding with them and calming them down. So it's part of a professionalism. So very, 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 very important. Even not only that, even dealing with other of our colleagues that work together, we need to also deal with them with emotional intelligence. Are you getting me now? So very, very important. All these things go a long way in ensuring that patients are being satisfied or our clients are being satisfied. Are you getting it now? Even in the aspect of language, when we are talking about customer satisfaction in our customer feedback form and all those stuff, we should not use ambiguous language. We should make our question, we should make our whether question, whether our customer feedback form or whatever, we should, what we are going to put inside, we should make it understanding enough. At least we should make it understand a layman. They should be able to understand what we want to get from them. So don't let us assume that all of them understand what we want to put there. So we should make the language simple as much as possible. So ambiguous statements should not be used in our customer feedback form. So very, very important, as the goal of our service or our quality management system, the major goal is for customer satisfaction before other things now follow. So once again, I want to appreciate the presenter. Then I want to also appreciate the organizer of this program, EHA. So and I want to also appreciate everybody that have also attended this webinar. And I want to urge us for us to continue practicing quality, living quality, and satisfying our patients. Thank you.
Thank you, Dr. Samuel, for your insightful contributions. Thank you very much. So I'm sorry, I will just give opportunity one more person, Linus Barry, and then while he's preparing to come up, somebody asked a question. He said sample was missing due to carelessness of the phlebotomy, and when the patient came, we begged him to take another sample, but he refused and threatened to take the case up. How do we handle this situation? So maybe you could handle this question and Mr. Linus's question together as we wrap up. Mr. Linus, the floor is yours.
Okay. Good evening, everyone.
Yes, can you make
I want to appreciate Dr. Yeah, I'm with you. I want to appreciate Dr. Aliu for the wonderful presentation, and then more grace. My questions are like, it goes this way. Just as you said, patients are not always right, but they have their own right as well. In so many times in the lab, I come across scenario that you see a patient will like dealing with time bound. Is there anything like how many hours should a technician work in a lab in order to guarantee efficiency or effectiveness in patient satisfaction? Because I come across a friend that worked like from morning till like 8 p.m. in the night, from 8 a.m. to 8 p.m. in a private sector. And I was not thinking this may affect his effectiveness in the lab, and then in the other way around, patient satisfaction as well.
Right. Thank you, Mr. Line.
Yes.
That's okay, so Mr. Dr. Israel, can you just take those two questions as we wrap up? Thank you, Linus. That's a very important question you just asked.
Okay. Now, as regards patient time for staff to for staff to work, definitely that's where the healthcare management comes in place. Because definitely you can't expect somebody to work 8 a.m. to 8 p.m. Are you getting me? And it's doing a high volume. Are you getting me? And you expect the person to be productive and expect the person to meet with one another time. No, if you do that, then as a manager or as an owner of the business, you're actually joking. So now, even where you don't work.
Hello, we lost you there, sir.
At that long as 9, like 8 to 5, depending. But however, it doesn't also look and the strength of the individual. So those things have to be put into consideration. There's what we call that, like that for a phlebotomy or for a scientist, there's a number of samples one person should be able to work depending on the kind of system. Is it a manual system? Is it a semi-automated system, or is it a fully automated system? So the volume of my throughput for an automated system, and even the automated system determines the kind of an analyzer So with the time, so if you have a better analyzer, better platform, so you could do as much as possible. But if you have to do everything manually, it'll be time. So those things have to be measured to ensure that the person is not overworked. Because if it's overworked, definitely there's no way to meet patient satisfaction. And patient satisfaction depends on the patient expectation. If you tell the patient that you're going to get your result in 3 hours, so you must put everything within the space of time to meet up without 3 hours. And if there's any reason why you cannot meet up without 3 hours, that patient must be communicated to before the patient comes for it. For most people, we don't communicate. We allow the patient to come. Where's my result? The equipment was not done or something like that. No, you have to communicate to the patient. So the managers or whoever it is must make the work in such a way that the scientist or the technician, whoever that is, become productive. You guys are not counterproductive. And that's why with staffing, adequate staffing is very, very important when it comes to delivering patient satisfaction. So for the next question, let me look at the.
Yes, I think a sample was lost.
Yes.
The sample was
the patient
lost.
sample was missing due to carelessness of phlebotomy. And when the patient came, he begged to take another sample. Well, but he refused and threatened to take us to court. Take the case up. We handle such a situation. Then, first and foremost, you have to do a root cause analysis. No, before then, you have to do what is called like immediate corrective action. First, you need to engage the client. This is what has happened. Sometimes, what I do when a client comes and the client is already disgruntled with one person, most of the time, take him to a higher person. Because if you take it to a higher, you feel that the higher person has the solution. That's why because I want to see your manager. I want to see the owner of the thing. I want to see somebody. He sees somebody, but it's not that does not mean that you are not somebody. He feels that because he has had that first encounter with you, you don't have a solution to his problem. He wants to see someone who is in charge. He wants to see a manager. He wants to see. And sometimes he says, "No, I don't. I want to see the manager. I want to see the director. I want to see somebody." Why? Because he or she feels that when he sees a higher person, he'll be better. So you need to engage the client, talk the client, explain to the client what actually happened. And you do, but it's unethical for you to be losing all patient sample due to carelessness. And that's the reason you need to create a system. So after that immediate action, the media action, you need to do what is the root cause of this. An adequate root cause analysis will determine the corrective action. And when the corrective action is taken, is implemented, you monitor to see if there will be what, if it is being effective or not. If it's not effective, that means the root cause analysis was not properly done, or the corrective action did not actually mitigate what the action. So that's it. You have to have a corrective. I've had issues where I had a project of really dealing with a lot of analytical issues, and basically, all I did was to create a system, put people, train them on what to do and how to do it, and put a system that cross-check. And definitely such things will not be happening. But if you beg, apologize to the client, are you getting it? Then at the end of the day, the sample again the same time to the same patient, and they will sue you in court. The truth about it now, people are becoming more aware about medical legal issues. People are becoming more aware about their rights. And the economy is inviting. So people are looking for where to claim money by all means. So don't be surprised that you go and they will take you to court because of carelessness. So please, it is very well. But that's why the healthcare profession is such a thing that if you are not cut out, or if your mind is not there, please don't. You can go and sell something else. You can sell cement, you can do business, you can sell a lot of things. But if you need to be in this space, you have to be with your mind, soul, and body, everything about you. And you must be a professional because it has to do with life. Let's say, for example, now, let's say it was a histology tissue. They remove one tissue from somebody and you were to take it for an analysis. You now want to go and lose the tissue. There is no, somebody cannot get two breasts. So it's only one. Somebody cannot have one. It's only one. If it's a motor now or a car that is spoiled, you can say, okay, go and buy a new car. Where will you see another tissue? Let's say, for example, now somebody comes and collects a sample. It was a pre-transfusion sample. and they have now transfused the sample. You did not produce the result for the pre-transfusion. How would the person get that same condition, that same time? So it's a profession that requires commitment, profession that requires system input in place, a profession that requires a lot, so that you can't be able to meet. Otherwise, you just not demanding the issue. But another thing I can also do, if talk to the patient, engage the patient, and also try to compensate the patient. So you have done that. There's a place I manage. The client came, brought a sample. The referral could not run the sample. He brought the second one. You know what I did? The third time, I have to go to we travel like 2 hours to go and meet the client, collect the sample there. We ran it, we refunded the client money. So he was saying, no, he doesn't want to say, no, we want to show him or her that it's not all about our money, it's all about what the quality of the service we want. We want her to be satisfied. This is a health condition. She must be satisfied. So we ran the sample 2 times. We couldn't get a good result. The third time, we have to travel 2 hours to the client's house, collect the sample, run the sample with our own cost, and also refund the same amount she paid for that test. So in other words, we ran the sample 3 times on our cost. That is satisfaction. Thank you. So you can compensate the client with actions and with things.
Okay, thank you very much, Ali Israel. I think from everything said here, it is clear that this topic is inexhaustible. Like the more we talk about it, the more we now relate it to our practices. There's so much that is involved. And like you said, at the beginning, patient satisfaction begins from when the patient comes into the facility until he leaves. And it is not just the facility owners that talk about the quality or the satisfaction they offer. It's the patient's feedback that really tells us so much of how well the patients have been catered for within the period they are under our care. Thank you very much, Dr. Ali Israel. I must say that this has been a very, very wonderful and enlightening
Okay, thank you, everyone. Thank you for your time. Thank you to the organizer. You all have a good night, guys.
We looked at the comment section. We got a survey. We're trying to gather some information that will be required, for another webinar that we will hold. So please, if you haven't filled the survey, kindly help us fill the survey. It will help us to impact of what is the level of practice, what we want to present next time. All right, so that will be all from us tonight. Israel, I will still be talking with you to appreciate you more, but from this platform, we want to say thank you very much. We want to say EHA Academy appreciates your time, your knowledge, and everything that you have contributed to us. And I believe the rest of the team, thank you. The rest of the members who have attended, so saying thank you very much. So thank you, everybody. You have a wonderful night. Dr. Ali Israel is accessible. You know that he's a coach, he's a consultant on so many matters concerning quality and patient management. He's a consultant as all of the things he has mentioned this evening. So we could still reach him further if you get his direct contact during this. Okay, he dropped his number on the comment section. Yeah, just dropped his on the comment section for those of us who are there, so you can reach him for the professional guidance requiring. Thank you very much. I'll bring this meeting to a close. So good night, everybody. Bye bye.